Hi, I'm Janine. It's my pleasure to introduce you to AdvancedMD. You've probably found that medical office software can be good at either billing or EHR, but few have strengths with both. With AdvancedMD, you gain a complete system that is easy to use and easy to learn, and it accommodates the unique workflow of all physicians in your practice. As a companion to the AdvancedMD practice management system, our EHR provides a comprehensive set of clinical and financial tools for patient care and practice profitability. And it replaces thousands of paper medical records with powerful features like electronic charting and prescribing, remote access, as well as an online portal to improve patient communications. We're hearing a lot about meaningful use and stimulus dollars. Let me simplify the CMS final rule to help you understand the incentives. Basically, you must use a certified EHR, and you need to use the EHR for e-prescribing. Number 2, you must be able to share clinical data with other medical systems. And third, you must be able to report on specified clinical quality measures. During this demo, I'll highlight several criteria that can be achieved with AdvancedMD EHR. That eventual $44,000 is nice, but in the meantime, you'll recover significantly more simply by going electronic and fixing inefficiencies in your revenue cycle management process. We believe the most important consideration when choosing an EHR is its ability to improve your productivity, so physicians have more time to practice and the flexibility to balance their lives. Imagine having an all-in-one solution that combines financial and clinical functions to yield efficiencies across all areas of your practice. This is the reality that AdvancedMD customers experience every day. We call this Medical Practice Optimization, or MPO for short. And it gives you more time for the things that matter most in your life. With EHR, how you access the application is just as important as what the application can do. What I mean by that is the value of EHR to the physician is greatly enhanced when they can use the application anywhere they have access to the internet versus having to drive into the office. Because our software is web-based or a SaaS technology, you have immediate access anywhere you work. All you need is an internet connection and you're ready to go. We even take care of just about all your IT frustrations. You gain the peace of mind that comes from having financial and patient information safeguarded in a banking-grade data center, making you more HIPAA compliant. By the way, this is one of the core objectives for meaningful use that we have just satisfied. There is currently a very large gap between the feature set of hospital EHRs and those that are available to the private practice. Typically, the million-dollar price tags for those elaborate systems are way out of reach for the independent physician, leaving you with a broad array of limited solutions. Because we are a web-based technology, all users have access to a feature set rivaling the capabilities of the best hospital-grade EHRs at an affordable monthly price. Let's now take a quick look at AdvancedMD software by kicking off the MPO process with scheduling. We understand ease of use is critical for training new hires, as well as keeping the sanity of your seasoned staff. Who wants to go in and out of several screens all day long to accomplish basic tasks? We make your life simple. This is our color-coded screen. Here, you can add and edit patient demographics, schedule, edit, confirm, check insurance eligibility electronically, collect copays, copy and move appointments, and schedule multiple resources and recurring appointments. All of this functionality is provided in one screen with minimal clicks. Let's move on to workflow. You can see here that Joan is scheduled for an appointment. To document her visit, we will go to the EHR. One of the major benefits of AdvancedMD is having access to all systems from a single login, meaning you only have to enter patient information once, a real time saver. My scheduled appointments are viewed in the EHR. With AdvancedMD, every person on your staff can have a unique login, letting you control levels of access and permissions. You can set the look and feel as well. I've chosen to highlight displayed messages. We can connect you to more than 40 labs. You can easily view and manage results here. This means no more stacks of paper and lost sticky notes to sort through. I'd like to point out that we just satisfied another meaningful use requirement. Let's continue with Joan's visit. As she visits with the nurse assesses and documents Joan's vitals, medical history, records smoking status, verifies her medications and medication allergies, completes a review of systems and Joan's active diagnosis. After this information is collected, a message can be sent to the doctor showing that Joan is ready to be seen. When this message is selected, I am taken directly to Joan's chart. We have just satisfied 7 more of the 15 meaningful use core set objectives. Many people wonder about the flexibility of EHR utilization between doctors. AdvancedMD accommodates the unique workflow of every physician in your practice. This is the customized view of a patient chart. Demographics and medical information are accessed by expanding the chart. The note I am using is from our content library. The information documented by the nurse is found here in the Vitals tab. Because charting preferences are personal and can vary between physicians within your practice, you can tailor the system to your workflow style. This is the portion of the note where I document. This is handy because it gives a quick view of all relevant information about the patient. Note templates help you document a patient's visit quickly and easily. On screen are a few of the ways you can document. Information from previous visits can be pulled into this current note. This saves time in documenting the assessment and puts more focus on patient care. Many of our new EHR customers want to know if they will be able to convert their paper documentation into electronic templates on their own. They are pleased with the speed and simplicity and their ability to sustain continuity of care. Our content library and template building tool allows you to modify the template. Let's now continue with documenting Joan's visit. The physician can see that Joan has not been feeling well. She's anxious and suffers from lightheadedness. This has been going on for 3 weeks and has been getting worse over the past 5 days. Earlier today, we performed an EKG. This shows the results were normal. During the physical exam, all areas were found to be normal. To document this finding, I select Normal and my preferred text is populated. I can add or change predefined text by selecting an option from this drop-down list or free type my findings. This allows me to expedite the documentation process, creating more time for patient care. Moving into the diagnosis, I can pull the hypertension and diabetes diagnosis codes from Joan's problem list and additional ICD codes if needed. I have an E&M coder incorporated in this note template. Based on documented information, I can see the suggested level of coding. While it can be modified, this is an estimated calculation. This also gives me insight to where I may need to add comments to my note. The CPT and ICD codes are populated in the charge slip. Consider processes that you would like to make more efficient. If you are like most, prescription writing probably takes up a big portion of your day. I know many find they have a top list of frequently prescribed medications. Wouldn't it be nice to streamline this process to a tiny fraction? With AdvancedMD, it takes just seconds to complete a prescription. Let me show you. I want to put Joan on a diuretic. With most systems, you'd have multiple windows and separate logins that slow down the process and create double data entry. And who wants that pain? In contrast, with AdvancedMD, it's this easy. Done! I just sent it electronically to Joan's Corner Pharmacy. And patient safety is always at the forefront. The system checks against a comprehensive list of contraindications. Let me point out that all this can be done anywhere, even from home. Also, we just satisfied 4 more of the 15 meaningful use core set objectives. Keeping track of patients who need to come in for follow-up visits or have routine labs performed is typically not the most coveted responsibility in a practice. I hear some pretty creative methods though, like Rolodex, spreadsheets, and a big paper desk calendar. Even with the best efforts, some patients fall through the cracks. Using Health Watcher, I can create and review any health maintenance protocol and easily see upcoming or outstanding reminders for Joan. This is a powerful tool as it allows you to assign health maintenance protocols for preventative care based on a number of parameters. The disease management and preventative care alerts are automatically posted to the patient's chart, and alerts are automatically sent to your designated staff. This increases your ability to ensure follow-up visits occur. Additionally, you can be aligned with best practices and automate processes that used to be manual and error-prone. You've just met more meaningful use objectives. Joan's visit does not require me to look at any images. However, while we are here, I want to cover a valuable feature. Links to X-rays and other DICOM-compatible images can be viewed in the EHR. Here, I can view Joan's X-ray. I can send a follow-up message to any member of my staff, or I can approve it electronically. Imagine being able to access all this from home. You can provide Joan a copy of her visit note as she leaves the office. This qualifies as meeting another core meaningful use objective. If Joan requests an electronic copy of her visit note and EKG, using the patient portal, we can satisfy another 2 menu set items. Yay! Work is done. Let's get paid. Joan's visit is here in my workspace. The CPT code reflects the services provided. I can choose my primary diagnosis code and approve the charges, which are now accessible for my billing staff. With a guarantee of 95% or better first-pass claims acceptance, AdvancedMD simply helps you capture more revenue faster. How do you know you are getting paid for all your work? Let's look at the process. The system utilizes these coding criteria and has created my list of all claims that need to be worked. Within the work list, I can make any necessary correction and the system will re-inspect and validate. This is my display of all electronic remittance provided from the insurance carrier. Here are the EOBs showing me carrier, method of payment, and total amount paid. Once I am ready to accept the payment, I can view the details of the EOB showing me each patient visit that was processed and accept payment. I can review how the payment will be posted to the patient's account and view any of the ANSI payments and denial reasons. This is where you manage denials. You can quickly follow up on unpaid or incorrectly processed claims. I am able to view any payment or activity that has occurred. Our work lists are configurable to your criteria. Having a complete billing process within the EHR yields an easier, more productive way to collect revenue. In conclusion, AdvancedMD EHR lets you be more efficient with flexible, customizable templates that give you the freedom to match the needs of every physician in your practice. We guarantee our software will remain compliant with all meaningful use criteria. You can ensure your practice and patients comply with medical advice and best practices. And lastly, you will get paid for the work you do with a 95% or better first-pass clean claims acceptance rate. Take the next step and request a customized online demo to see how easy it is to begin charting electronically. Call the number on your screen or email us today.